Tess was born with a cyst in her brain. She had neurosurgery on day 2. The cyst resulted in a seizure disorder and an endocrine disorder. She's legally blind, she's in a wheelchair. But other than that, she's the happiest, bossiest child you'll ever meet. She was seen by most specialists, endocrinology, neurology, the visual impairment program, on a regular basis every 6 months for about 18 years. Children's Hospital transitions you to adult care when you turn 18. We transitioned to endocrinology at St. Paul's Hospital and to neurology at VGH Hospital. What I didn't realize is that they wouldn't have all of the information that have been captured over the last 18 years.
Patients, when they would come into our office, would say things like, "Can't you see this?" or "My records should be on your system," and we would have to provide an explanation. We relied on paper charts for most of our information. It was often difficult to get the full picture of a patient's illness before they arrived because we would be dealing with incomplete records.
Once I realized that they didn't have access to her paper chart from Children's Hospital, I started keeping track of my own chart. I created a folder and I kept track of all of the discharge summaries, all interactions across each of my specialists and my GP so that I could have the information on hand to look up for myself as well as share with the other doctors that I was meeting. You don't know what information that you may forget to tell somebody is important to the care of your child, so it seems to put a lot of responsibility on the parent. I had no idea as a patient of British Columbia or as the parent of a patient that we have 3 health authorities within 10 kilometers of one another.
CST spans our 3 partner health organizations, which are VCH, PHC, and PHSA, providing us a common platform for sharing information about patients. Often we'll have patients that receive care in more than one of our health authorities. Since the go-live of CST at VGH, it has become much easier to receive information about new patients that are coming into our clinic. I'm able to easily access any record for care that was delivered at one of our CST facilities.
I now know that any of the documentation entered into CST Cerner is available to any of the specialists I see at any of our facilities, and if I show up in Emerge, they all have access to that information.
CST has brought us to a place where patients and families might have expected that we were 5, 10, 15 years ago. Better access to information helps to protect patient safety by making it less likely that things will fall through the cracks.
I truly believe that care is safer when you have a single patient record, where you can't lose referral information, when you have access to information that you don't have to remember or go looking up in a patient chart that may have volumes of paper in it. I want to be able to go anywhere in BC with my child and know that her healthcare information is available to whatever clinician, care provider that I see. I believe we will get there, and I believe that when we do, this will lay the foundation for the true transformation that can happen in healthcare.